Well, so can you see the slide full screen?
No, ma'am.
Well, we have to do it one more time. Can you see it now?
Yes, ma'am.
Okay. So I was speaking about the third sentence, and that the structure of the first sentence shows that this is the second conditional, and instead of becomes, we need to use the past simple tense, right? So what is the correct form here in the if clause? If it were, yes, because it was not normally actually become, it was the verb to be, if it were something sinister. As for the fourth sentence, if your father gets any worse, we will probably admit him. So will in the main clause will admit future, and in the if clause we should use the present simple here, gets. It's okay here. And the next, if I did the operation again, I would take greater care. So here we also had would take. It shows that this is a hypothetical situation, and this is the second conditional structure. And that is why in the if clause, we need to use the past simple, if I did. So in number 6, if it were meningitis, your child probably wouldn't be so lively. And so wouldn't be shows that this is also hypothetical situation. That is why the verb to be should be used in the past simple, if it were in the if clause. As for number 7, if I set the exam again, I will prepare myself better. Is the situation real or hypothetical in this case? Hello?
Hypothetical.
Hypothetical, of course. That is why in the main clause we can't use will. We should use would, right? If I said I would prepare myself better. Then number 8, if your mother needs any medication, we would give it to her. Would give shows that this is also unreal, imaginary, hypothetical situation. Actually she does not need any medication. That is why we need to use past simple after if in the if clause instead of needs. What is the past simple of need?
Needed.
Needed. If your mother needed any medication. Okay. Number 9, if your child will be very dehydrated, you need to bring him into ND. This is just a very obvious mistake because we don't use will after if. So in the if clause, instead of will be, what should we use?
Is.
Is, yes, the verb to be in the present simple. If your child is very dehydrated, you need. Actually, there is no will in the main clause. There is, so this is present simple. You need to bring, okay? And the last one, if your child stays in the hospital, we will keep a close eye on him. This is correct because this is the real condition. We have stays present simple in the if clause and will keep in the main clause. So here are these sentences you can see with the correct form. So it should be used in these sentences. Do you have any questions on the homework, on the home assignment that you've done?
No, ma'am.
No, I see. Okay. Now let us move on. And so we are starting speaking about psychiatry, and you see, so if we speak about this the sphere of medicine, we first think about the origin of this part of medicine. And so these are the people so from the history of psychiatry. And I think we know something about them. Let us think what they've done in psychiatry. The task is to match the pictures with the descriptions. Actually, the description is a question. So the first one is, who introduced cognitive behavioral therapy? Do you know this person? Is it Rayl, Cade, Freud, or Beck? Maybe you can answer the other questions. For example, so I think among these psychiatrists, the most famous person is Sigmund Freud, right? So, and what has he done for psychiatry? If we choose from these 4 descriptions.
Ma'am, second one or option B, ma'am.
So you say that Freud described his structural model of the mind, right?
Yes, ma'am.
Okay. Yes, exactly. Bingo, you're right. And what about if, for example, we look at the this description? Who was the first to use the term psychiatry? I think it should be the earliest step in the development of the science. Rayl, yes, and this is the obviously the oldest picture. Yes, Rayl was the first to use the term psychiatry, and we have 2 more people, Cade and Beck, and we should understand who is connected with the behavioral therapy and who introduced lithium for treatment of mania. So, any ideas?
Beck for behavior therapy.
Behavioral therapy, yes, you're right. And so Cade introduced lithium for treatment of mania, this psychiatric disorder. Okay, and the question, is it important to be aware of the history of medicine in general and psychiatry in particular? Why not? What do you think? Yes, who would like to say something? Please share your opinion with us. Sinju, what do you think?
Yes, ma'am. Even I think it is important to be aware of the history of medicine, particularly in psychiatry and all, because a path in which it came will describe how the that was developed. So, for example, if a person or a doctor is treating a patient, will normally take a history from the patient. Likewise, if we know the history of the part of psychiatry, we will know what all to ask that patient, how it has evolved. So it will be useful.
Okay, thank you. Any more ideas? Yes, Hala Malik, what do you think?
Well, I think that it is really necessary to be aware of his history of medicine, because from that we can understand how the person has been going through this situation, and what are the changes, ups and downs faced by him during the medication and during the treatment. Also, it helps to identify whether by giving one type of medicine will he have any other reaction or not. So it's really necessary to study his medical history before giving him any treatment. Then we can get the opinions of other physicians or psychiatrists, what they have studied about him. So it will be helpful for the current psychiatrists to know more about the patient, also in different views. different views, the view of the previous psychiatrist and
Exactly.
the view of the current.
Thank you. So we can just compare the cases that were described by the previous psychiatrists, the previous people working in medicine and different spheres of medicine. Okay, thank you. And actually in psychiatry, doctors need to be observant of the patient's appearance, behavior, and manner. So this will help in their diagnosis. That is why we are going to speak about the words which can describe the behavior of patients. So they are given here, and we should be so I would like to be sure that we understand all the meaning of the words which are given here. So to the left, we can see several nouns that describe behavior of patients, and there are definitions given to the right, and our task is to match the nouns and definitions. As for aggressiveness, for example, let us look at the definitions. So what is the meaning? Which definition does aggressiveness match with?
C.
So yes, we will fight, argue using forceful methods. What about restlessness?
E. Continuous movement.
Exactly.
Continuous movement.
Yes. Then there is a withdrawal.
Moving away, not wanting to
Not wanting to communicate.
Not wanting
Moving
to
away.
communicate. D. Yes, this is withdrawal. The next is distraction.
Inability to concentrate.
Inability to concentrate.
Okay. Okay. Flamboyance.
elaborate or colorful
Behavior. Yes. The next is anxiety.
feeling of
Feeling of
Very nervousness.
Nervousness. And carelessness.
Being
Being
not
not
accurate, not
Being
caring.
not accurate, not
not
caring.
caring.
Yes, Asna. Not caring. How do you do this,
Surama.
Asna? I see. Okay. Well, now, so we have the same list of nouns. I would like you to write the corresponding adjectives next to each noun. For example, if we speak about adjective connected with aggressiveness, what is the adjective?
Aggressive.
Aggressive. We say
Aggressive.
behavior, aggressive behavior. So please, 2 minutes for you to write these nouns and adjectives in pairs. Write the corresponding adjective next to the nouns, please. Write them down. Well, so let us read the pairs of words, noun plus adjective. Asna, will you read them, please?
Yes, ma'am. Restlessness. It is restless.
Yes, continue, please, Asna.
Ma'am, withdrawal is withdrawn, and distraction it is distracted, and flamboyance is flamboyant, and anxiety is anxious, and carelessness is careless.
Will you repeat, please? Withdrawal. What is the adjective?
Withdrawn.
Withdrawn, exactly. Okay. Well, here they are. Yes, and so this is a kind of picture about distraction. So weapons of mass distraction. So it's like social media. Well, yes. And now we are going to, there are several cases, 7 cases here. And we are going to read about this each case, and we should complete each case with the adjective that describes, that better describes the behavior of these people. So, for example, if we look at the first sentence about John, so John was about his appearance. He was shabbily dressed and his hair wasn't combed. Which adjective from those which we have written should be used in this sentence?
Careless.
Careless.
He was careless about his appearance. Exactly, you're right. Okay. So now let us have a look at the other sentences, please. Let us do it individually. Then 3 minutes to you just to deal with the other cases, and just to use the correct adjective in each of the gaps here. Start, please. Well, let us check what we've done. Well, the second case is for Shamisha, please. Shamisha, hello, are you here? Now, Ramisha,
Yes, ma'am.
number 2.
John, first question, ma'am.
Yes, about John. Jane, no, number 2, please. Number 2.
Jane was dash. She barely said a word. When she spoke, she did not look at me. Jane was withdrawn.
Exactly, yes. Good. So, John Farvin, please.
Yes, ma'am. Harry was dash. He could not sit still and kept twisting all the time. Harry was restless, ma'am.
Okay. So the next is Hala Malik, please.
Mary was very anxious. She was forced, but you could tell she was worried about something. Anxious.
Anxious. Good. Thank you, Sultan.
Yes, ma'am.
Mm-hmm.
Pat is a flamboyant and she dresses in quite extravagant and formal clothes with bright colors.
Exactly. Good. So, Sinju, please. The next sentence.
Susan was very aggressive. She was very argumentative. I did not feel safe and sat with my seat near the door.
Okay. And the next is for Danish.
He appeared distracted throughout the interview, looking out of the window as if he was hearing voices.
Distracted by voices. Okay, good.
Yes.
Thank you. And so, yes, here are the sentences completed with the adjectives. And the question, are the descriptions related to such psychiatric disorders as mania, psychosis, depression, or anxiety? What is your diagnosis? So if, for example, we speak about mania, so if we look at sentence number 5 about Pat, she's flamboyant about her, she has a mania about how she looks like, dresses extravagant just to attract attention. This is the sign of mania, you see? And if we look at the first sentence, John, who is shabbily dressed and who is careless about his appearance, how he looks like, and about Jane, she's withdrawn and she doesn't look at the doctor. So what is the diagnosis? How can we describe her behavior? Yes? Any ideas? Is it mania, psychosis, depression, or anxiety?
Psychosis, ma'am.
Psychosis, ma'am.
Psychosis is more aggressive, and these people just don't care about anything. They don't pay attention to anything or anyone. This is the sign of depression. You see, if the person is depressed, so the person is not interested in anything. You see, this is depression. And if you speak about sentence 3 and 4, so Harry, restless, Mary is anxious. So here is anxiety, yes. So the people, this is their diagnosis for their behavior. And number 6 and 7, like Susan, yes, aggressive and distracted, like hearing voices. This is exactly, this is psychosis.
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 Okay, so these are the most common psychiatric disorders. And yes, and these disorders are affective, but they can all also have organic causes. And these are the disorders that specialist psychotherapists just deal with in their practice. Now we are going to start listening, but before we do this, I would like you to just yes, we're going to listen to the doctors who describe they describe the three patients, Mr. Jones, Miss Rigby, and Mr. Dixon. And we should make notes about these patients using this this table. I would like you to draw the table. So on paper, just to be able to just to take notes about each of the patients. So please draw the table before we start listening. So there should be 6 lines here, like the notes about appearance, about eye contact, whether the patients, so keep eye contact, about manner, how they behave, mode of speech, and insight. Insight suggests here that it's like whether the patient understands that something is wrong with him or her. And doctor's feeling, how the doctors feel about each situation, each case. Yeah. So it looks like we have less than 1 minute, and so we'll take a break, a 10-minute break after the session finishes, okay?